I am Dr. Sloan, better known as OrthoDoc, and just when you thought it couldn't get any worse, the Trump administration unveiled on Wednesday, this past Wednesday, July 30th, that they are now going to share all of our data, our health data, with other organizations that we may not have initially subscribed to and or want our information shared.
Today, the dream of easily transportable electronic medical records finally becomes a reality. I also want to thank representatives from Apple, Google, Samsung, Amazon, OpenAI, Anthropic, Epic, Oracle, Athena, Health, Noom, and that's not a bad group of people. Wow.
It's called the Private Health Data Tracking Initiative, and that means Apple, Google, Amazon, United Health Group, CVS. These are some of the big dogs that are going to be basically sharing your information across platforms. So don't get me wrong, I think that healthcare and medicine are definitely behind the eight ball and behind the times when it comes to technology. But sharing all of this data, a lot of it is driven by body mass index and weight and glucose and your hemoglobin A1C and maybe some other labs. But it also includes data that you may not want to share. But here's the rub: you don't necessarily own that data. So in 2016, TED part of a subsidiary of TED Talks, it's the medical side, if you will. I was honored to be one of the TED scholars. So I got to go in and listen and participate, initiate some of the beehive conversations. And there was one guy that actually spoke, and I remember, even though it's been almost 10 years now, Bruce Schneier, and he was titled by The Economist as the cyber guy. He was the security know-it-all, if you will. And he talked about who owns your data. And unbeknownst to us, even 10 years ago, we don't own a lot of our health data. When you think about your Fitbit or your Apple Watch or the data that you're putting on the health apps, that kind of thing, at some point, somewhere, there was probably a disclaimer that you basically released all of your health data. And so, therefore, you don't necessarily own it. So, even think about it. When you go to the doctor's office and you want to obtain your medical records, you have to go sign a release to get your own data and information. Sometimes that's controversial, but yeah, you don't really own your own health data. So now fast forward to big technology and this whole thing of sharing data, provided that Trump wants to be on the up and up. I doubt that. How and who actually controls the data and what information are they getting? But more or less, what are they doing with that data? Medical data is the mother lode when it comes to sharing with companies, PR, marketing, branding, anything that a company can basically create around your data that may, with the assistance of AI, benefit others in the future. You're basically now part of that subset. Yeah, this is an ethical nightmare because your data is not just being collected anymore. It's now being leveraged and sold to the highest bidder. And unbeknownst to you, someone else is going to financially benefit. I promise you. So it's not just about Epic and MyChart and all of these other organizations that you may be, part of, CVS or your healthcare insurance company. Do we want them to be able to talk across platforms? I guess we want them to. But what other data and information that will be shared that we have no control over? Welcome to George Orwell's 1984.